Thank you. Thank you for being here for the second part of navigating gender affirming care in Massachusetts. My name is Leslie Diaz. My pronouns are she, hers, ella, and I am a tan Latina woman with black wavy hair. I am from my ombudsman. You'll learn a little bit more about us later. And we're co hosting this virtual event in collaboration with partners Fenway Health, Health Law Advocates, and Trans Resistance of Massachusetts. The idea for this event came about as policies and resources started popping up here and there for folks who have been seeking gender affirming care. And with all the knowledge and information that's out there, we wanted to make sure that people knew how to access it. We know that there's a lot of barriers that can come about just seeking healthcare in general. So we really wanted to make sure that we were bringing out all these resources as much as we could to the forefront, allowing folks to access gender affirming care more easily. So for this panel, we're going to talk about navigating healthcare, navigating gender affirming healthcare as it relates to health insurance in Massachusetts. We have Hannah Fergand from Healthcare for All, Kara Hurwitz from Health Law Advocates, and I will be talking about my ombudsman. So we will go ahead and take it away with Hannah to get us started on healthcare coverage here in Massachusetts. Thank you all.
This is Hannah. Great to be with all of you today. My name is Hannah Fergand. My pronouns are she, her, hers. I am a white woman with brown wavy hair in a gray and black shirt. And I'm at Healthcare for All. I'll give a little bit of an overview of that and also accessing health coverage for gender affirming care in Massachusetts. So I'm going to share my screen. All right. So the agenda will be a quick introduction to Healthcare for All and what we do. Health insurance in Massachusetts, brief overview of just what's out there in Massachusetts for coverage, going over mass health coverage, and how mass health can work as your only coverage or a secondary coverage. And some brief tips on using mass health and how to apply for coverage. So Healthcare for All is a nonprofit advocacy agency. We've been around for about 37 years. And we advocate for health justice in Massachusetts and work on making the healthcare system better. And we do this in various ways. We have 3 buckets of work. We do direct service, helping people through our consumer helpline. We do policy work, passing legislation, advocacy, and coalitions. And we do outreach and organizing work to hear from the community what issues there are with access and coverage. So part of my role is overseeing our helpline. Our helpline is a free resource that answers calls in English, Spanish, Portuguese, Haitian Creole, and French. We have trained enrollment assisters who can help people through the process of getting coverage and troubleshooting issues. So now I'm going to go into really briefly just the landscape of what health coverage is available for individuals in Massachusetts. So the first program is Medicare, which is a completely federal program for people over 65 years old or people receiving Social Security for disability. There's Medicaid, which in our state is Mass Health, that people can qualify for based on income or disability or pregnancy status or HIV positive status. There's Connector Care, which is a program that can subsidize private insurance up to a certain income level to get lower costing health insurance with minimal copays to pay for services. The last bucket is private health insurance, which could be through work. It could be through going through a carrier directly for insurance or purchasing insurance through the Health Connector. So I want to go deeper into Mass Health, which again is our state's Medicaid program. And Medicaid is a partnership between the federal government and state government. Each state's Medicaid program is vastly different with eligibility and what it covers. And Mass Health eligibility is based on income, household size, immigration status, disability status, age, HIV status, and pregnancy. So many factors. Which goes into my next point that even within a family unit, eligibility is determined on an individual level. The only out-of-pocket cost Mass Health members have are for medications, which range from $1 to $3.65, or some programs may have a monthly premium. And there are members that don't have to pay for medications. So again, each case is kind of unique, which is why there's people like our helpline to help navigate the questions about health coverage. So within Mass Health, there's a bunch of different programs with different eligibility guidelines. And so that's why including information like pregnancy or disability status can qualify people for greater benefits. This chart I know is a little dense. So this, I know materials we shared after, but it's just to give a breakdown of the different Mass Health coverage types and who qualifies for it, as well as the difference in benefits. So standard and common health offer the same coverage, and it's very comprehensive. It's geared at people who might have a lot of medical needs. And the difference is income eligibility. If you're under a certain income level, you can get standard. If you're over that, but meet the disability criteria, you can get common health still. So family assistance and Care Plus are both pretty comprehensive coverage. The only big difference is does not cover the same in-home care services or like PCA services. And there's different eligibility for these programs. Care Plus is basically if you're an adult without children. Family assistance has a lot of different eligibility criteria that different people could qualify for based on immigration status. If you have like a pending immigration status, you could qualify for family assistance. It could be that your family's income is over for standard, but still could get family assistance for the children. So I'm just going to briefly go through the rest of them. Mass Health Limited is just covering emergency services. And there's a couple of important notes about Mass Health Limited. It usually, or I will say always, acts with another coverage type. So for kids that are under 19, they can get Children's Medical Security Plan with it and some coverage through Health Safety Net, which I'll go over in a second. For adults, they can get Health Safety Net or possibly the Connector Care program with Mass Health Limited. There's plans that offer premium assistance for Medicare to cover like the Medicare premium. And then, so the Health Safety Net program that I mentioned before, you do not have to have an immigration status to qualify for it. You must still meet an income guideline to qualify, though. And with the Health Safety Net, your care is limited to just community health centers and public acute hospitals. It's not full health insurance. And lastly is the Children's Medical Security Plan. And I think before I said kids under 19, I meant kids under 18 can qualify for this program if they're not eligible for greater coverage. So mostly who's in this program are kids who are undocumented or families that have a higher income level that would go over the Mass Health guidelines. I caution people with Children's Medical Security Plan that it's what I call a well child plan. It does not cover emergency services, has caps on medical equipment, behavioral health, prescriptions. So it can be a limiting plan. And then on the bottom of this page, I have a link to the chart of Mass Health covered services. It's a very long list, but it can be helpful if you're trying to figure out what's covered by which plan. So you can have Mass Health as your only coverage, which is what we would call primary, or you can have it as secondary coverage. If Mass Health is your only coverage, you will be prompted to select a plan within Mass Health. If you have other insurance, like work insurance or Medicare, Mass Health will act as secondary to that. Mass Health can pick up copays and deductible costs for services that are covered by Mass Health. Mass Health can also wrap for coverage. So if your primary coverage is not going to cover a service, and Mass Health would, Mass Health can cover that service. And there's potentially premium assistance availability if you have it as secondary and need help paying the monthly premium costs for your other insurance. The last note is that you may have a monthly premium for Mass Health Common Health, even if it is secondary, because it's based on your income eligibility. So when I speak to callers who are trying to get Common Health secondary, my big piece of advice is once you get determined, you have 60 days to decide if you're going to keep Common Health or close it because you determine that the premium, is not going to offset the other cost you're looking Mass Health to cover. So I wanted to give just a case example of how Mass Health as secondary coverage works. So Sam is single and works while having a long-term disability. And Sam is trying to access gender affirming care and has work insurance that's not fully covering what they need. So they apply for Mass Health, get Common Health coverage based on their disability, and Mass Health will then act as secondary to the work insurance. And it starts to pick up the copays for services covered by Mass Health. And then also, when Sam is denied hormone therapy through work insurance, Mass Health could then cover the therapy, and then Sam is still able to get the treatment they need. Okay. So just going over quickly how to apply for coverage for Mass Health, the Health Connector, Health Safety Net, all of those programs are through one application. So you don't need to know what you would qualify for. The application can do that for you. So if you're under age 65, you can apply online at mahealthconnector.org. Or over the phone with Mass Health or the Health Connector. or with an enrollment sister like our Healthcare for All's helpline, helping complete that form. The last, and in this case, actually least, option is paper application. And I say that because with an online or phone application, you can often get a same time determination. With a paper application, it can take up to 45 days. So now that I said that, unfortunately for the over 65 population, right now there only is a paper application. So it can take up to 45 days to hear back. Hopefully they're working on ways to submit forms online in a better manner for the future. But for now, it's a paper form if you're age over 65 or in a nursing home setting. All right, so this is a very important slide. It's basically if you receive mail from Mass Health or the Health Connector, make sure you respond to it. And most importantly, update your information, particularly your address and contact information, so that you're able to get mail sent to you if you need to keep your coverage. Basically, it's important to respond and make updates about your household information so that your determination is based on correct information. And then lastly, enrollment assisters are able to help with this process. They can complete applications. They can check on your coverage to see if it still is active, make updates to your household, help with selecting a plan at the direction of the member, and troubleshoot issues by contacting Mass Health and the Health Connector to figure out any barriers to care or coverage. So on the Health Connector page, there is a link to find enrollment assisters in your community. And of course, you can call our helpline as well for help. All right, so I am going to stop sharing my screen and turn it over to the next panelist. I just want to check. It doesn't look like there's any questions in the chat, and I know we will take more questions as a panel later.
Okay, I think I am the next panelist. Good morning, folks. My name is Kara Hurwitz. I am a white non-binary person in a red shirt and a blue cooling cloth because it's going to go up to mid-80s today. And I am, my pronouns are she and they. And I am a staff attorney with Health Law Advocates. And it's my role today to talk to you about accessing gender affirming care in the mass health systems, and in particular, ways that Health Law Advocates can support folks who need legal supports as they're navigating this. So I'm going to go ahead and share my screen as well so that you can see the slides I've prepared. Oh dear, it looks like I also do not have access to screen sharing. If a host could enable that for me, I would appreciate it. All right, thank you so much. I appreciate it. Okay, so hopefully everyone is able to see these slides that say accessing gender affirming care in mass health systems. Um, and without further ado, I will go ahead and get started. Okay, so let's start by talking a little bit more about what I guess we'll talk about what we're going to talk about today. Um, so I am going to start by talking about what types of legal cases we see, issues, common barriers that people experience when they're trying to access gender affirming care. And then I'll talk a little bit more specifically about navigating mass health appeals, because that is a very common area where people may need legal supports. Okay. All right. So that being said, I want to start by talking about gender dysphoria, which I'm sure is a topic most folks here today are already familiar with. But because it is sort of the touchstone for all of the coverage related to gender affirming care, I want to make sure it's where we start today. So several different medical professional organizations have definitions in their books. The American Psychiatry Association defines it as a concept designated in the DSM-5, which is the clinical manual used to diagnose behavioral health medical issues. It is a concept designated in the DSM-5 as clinically significant distress or impairment related to a strong desire to be of another gender, which may include desire to change primary or secondary sex characteristics. Not all transgender or gender diverse people experience dysphoria, but dysphoria is the touchstone for assessing gender. So I'm gonna move us forward just to see what the DSM says, because it's referenced in that first definition. The DSM defines it as a marked incongruence between one's experienced or expressed gender and signed gender, which lasts at least 6 months. And then they have this whole host of criteria that it can manifest as. And the reason they do this is because it's very variable from the person, what people experience as gender dysphoria. So they sort of have these 6 criteria, and 2 have to be present. These can be social in nature. These can be cognitive in nature. These can be physical in nature. But the piece I really want to make sure folks understand while we're talking about accessing gender affirming care is that this underlying and underpinning thing that people experience of gender dysphoria can have a lot of different roots and is being used, is being addressed through a medical intervention of some type. So we'll talk about, there are a lot of different things that can be gender affirming. Today we're talking about gender affirming care, and this is the touch that's used for that. So the WPATH, which is a world-based organization, has its own definition. It's maybe a little bit behind the other 2. I'm mindful of our time. I'm not going to spend a huge amount of time on this, but it also notes the distress that's caused by this discrepancy between a person's gender identity and that person's sex assigned at birth and the associated gender role for primary and secondary sex characteristics. So the main thing that all of these things have in common is, again, this distress that's caused by a discrepancy, which can be addressed through some form of gender affirming care. Transition can be a form of gender affirming care. It's not the only form of gender affirming care. I'm sure many folks on this call already know that. And I would be remiss when we're discussing gender affirming care if I didn't clearly state that conversion therapy, so the act of trying to make someone's internal experience match their external markers of gender, is not gender affirming care. It is not recognized as gender affirming care by any leading professional associations that do work on gender affirming So moving us forward, I'm sure folks on this call are aware of the many benefits of accessing gender affirming care. It's very important for folks who need it. My organization, Health Law Advocates, let me pause for a minute and just tell you how we work with folks on that. I am currently the project lead for an initiative called the Trans Health Access Initiative, which does 3 things with to support folks who are trying to access gender affirming care and to support gender diverse populations in general. So the one we're going to talk most about today is legal representation for folks who need access to services. We also do trainings like the one I'm doing right now. We do policy advocacy through the Transgender Health Access Coalition, but we're here today to talk about legal representation and a little bit more about what that looks like, how my organization can support folks who are having difficulty accessing gender affirming care, and also just what the process might look like as a practical matter if you're trying to access gender affirming care. So Mass Health covers a number of different forms of gender affirming care. They are kind enough to put the whole list on their website, and the link to that I pulled this from is included in the alt text of these slides. So there are several different things that we might be talking about when we're talking about gender affirming care. So we're going to be talking about primary care. My colleague Hannah touched on hormone therapy and puberty blockers a few minutes ago. We might be talking about culturally competent behavioral health services for gender diverse populations. We might be talking about gender affirming surgeries or hair removal, either as part of the process for gender affirming surgery or as its own process for addressing gender dysphoria. We also might be talking about speech therapy, and there are a handful of other miscellaneous things we might be talking about as well that are not explicitly called out on this website. But those are kind of the big categories that folks are often referencing when they're talking about medical gender affirming care. Okay. So there are certain things that my organization tends to see most often if we're helping folks access gender affirming care. There are other things that don't tend to be difficult to navigate from a legal perspective for whatever reason. So we don't see them as often. But the biggest issue we see by far, or rather the 2 biggest issues that we see by far, I should say, are a denial of a medically necessary service because it was determined to not be medically necessary, or an issue with reimbursement of services by people's insurance. Those are the 2 we see most often by far. And then folks may also need help with accessing out-of-network or out-of-state providers, which I see Steph asked about in chat, so I'll touch on that very briefly now. Folks need help with things that are not related to gender dysphoria, but are still related to their healthcare. And sometimes folks need help figuring out how to navigate the prior authorization process, because prior authorizations, especially for gender affirming care, are they're kind of non-intuitive and convoluted. It can often be difficult for people to get all of the pieces together in a row in order to access things. So just to touch briefly on Steph's question in the chat, assuming I can pull it up with the screen sharing I'm doing, which is admittedly more challenging than I want it to be. Steph asked about a Mass Health plan telling them that their client, the clinician they want to see as PCP, is too far away. There are any ways to get exceptions to this. The short answer to this, as I'm sure Steph knows, because they see folks at Fenway Health and help them with this, is yes, it is very possible, as my slide suggests, to access out-of-network or out-of-state providers if those providers are providing a form of care that is not accessible in network, and certain types of gender affirming care, or even just culturally competent care provided by someone who's used to working with gender diverse populations, can be potentially documentably needed, medically necessary. And that is a thing my organization can help with if folks are having difficulty with it. So that being said, I want to do a deeper dive on those two issues that I flagged as most common for my organization. Gender affirming care. But before I do that, I want to touch briefly on the different forms of gender affirming care in a little more depth. Hormone therapies, such as HRT or blockers, are a form of gender affirming care. Gender affirming surgery is a form of gender affirming care that can look a lot of different ways depending on what someone needs help with in order to address gender dysphoria. Hair removal, and as I mentioned earlier, that can be pre-surgical or it can be its own form of gender affirming care. And then therapies such as vocal therapies can be a form of gender affirming care. Of this list, I think it's fair to say that my organization works with folks most often on surgery-related gender affirming care and hair removal-related gender affirming care. For whatever reason, we don't tend to see cases where, here in Massachusetts, where people are struggling to access hormone therapies. That is definitely an issue that people have many places in the country right now. I consider it encouraging that my organization doesn't see those cases very often. It suggests to us that people are a little more able to easily access hormone therapy than some of the other things that they need. Okay. That said, there are a number of different barriers that come up for those two issues I just mentioned, especially because it is very common, especially historically, but still unfortunately today, for insurance entities, especially private insurance entities, to conclude that forms of support may be cosmetic in nature rather than medically necessary care. And this is often incorrect. Under the insurance's own policies or under protections that exist within the state and federally in order for people to access gender affirming care. And I will talk about that more on our next panel when we talk about knowing your legal rights. But for now, be aware that many things that might be considered cosmetic in other contexts may be medically necessary if they're being used to treat gender dysphoria, which again is the touchstone for gender affirming care. So someone who is removing hair from their face, to give a concrete example, may, in some contexts, we might view that as not related to a medical need. But in this specific context, if someone is experiencing gender dysphoria related to the hair on their face because it feels incongruous with their gender identity, that is an example of a service that is covered by Mass Health as medically necessary for people who are experiencing gender dysphoria as a form of gender affirming care. Okay, and this gets back to what I was saying earlier about gender dysphoria being very person specific and potentially manifesting a lot of different ways. So it's important to look on a case-by-case basis at these cases, which is one of many reasons that my organization may need to step in if an insurance entity is trying to apply a one-size-fits-all approach to an underlying medical need that is person-specific in nature. So that point sort of leads me to my second point on this slide, which is insurance denials. It is unfortunately common, especially for certain types of requested care, to receive insurance denials, sometimes as a matter of course. And part of my organization's role is to help people appeal those denials when they're not appropriate. So that's something that my organization is happy to help with if you encounter it. And in general, be aware that that is a barrier for folks who are trying to access gender affirming care. On a related note, provider billing issues, especially on certain types of gender affirming care, it may be difficult for providers to properly bill for the services they've provided. It may be difficult for consumers to receive reimbursement for care that they have had to pay for out of pocket. Those are also things that my organization is working to help folks with. And in addition to the sort of those top three, which are underlying legal issues that can be addressed through legal action, there are a lot of additional barriers that people have to navigate in their day-to-day. And I know we talked about several of these on Thursday. Working with providers who are not culturally competent to work with folks who are gender diverse. Trying to navigate a burdensome prior authorization process that frankly is more convoluted than a lot of other forms of care. Many places have age of majority restrictions, including Massachusetts, have age of majority restrictions regarding accessing certain forms of gender affirming care. Some types of surgeries, it can be very difficult to get approved before someone is 18 years old. Similarly, parental consent may be required for someone who is under 18 for certain types of medical care. That can also get tricky if there are two parents who have differing views on whether someone who's under 18 may access gender affirming care. And then, of course, as Steph alluded to a few minutes ago, inadequate provider networks are still a problem in Massachusetts. We've come a long way in the time that we've been working on this issue, but we're still not where we need to be in terms of making sure everyone is able to access everything they need within their provider network, which is why it's important to be aware that you can potentially set up out-of-network services with your insurance entity. And then the last barrier, unfortunately, there are some types of service which are just not covered at this point in time. This is an evolving field. We are developing a better understanding of what people need in order to access gender affirming care every day. But for some types of gender affirming care, the research hasn't really fully reached insurance entities yet, and there are categorical exclusions for certain types of care that are less common and less understood. So that is something that my organization does help folks with. If you received a denial for a type of care that it seems like your insurance entity just doesn't understand or says is not covered at all, but that is an area of sort of constant work within this field as our understanding of the field evolves. Okay. Okay, so all of that being said, let's talk a little bit more about this idea of medical necessity versus cosmetic, because it is a touchstone for a lot of appeals that we see in my office. Medical necessity is not an issue that's gender affirming care specific. It's required for a lot of types of insurance coverage, and it means different things in different contexts. Some things require prior authorization in order to access them. Different procedures require different things. It is unfortunately common to need one or more letters of support from a doctor or therapist in order to access any types of gender affirming care. And again, as I mentioned, the touchstone is a diagnosis of gender dysphoria, and that in its current definition requires experiencing gender dysphoria for 6 months or more. So those are all things to be aware of when we're talking about documenting medical necessity for gender affirming care. So all of that being said, I'm happy to pause briefly in case anyone has questions that have come up relating to all of those topics before I do a deeper dive into appeals in particular. I am not seeing any questions, so I'm going to be mindful of time and move us forward. But please feel free to ask things in the chat or in the Q&A if you have questions relating to things I'm covering right now. Okay, so the main thing about appeals that I want to make sure folks are aware of, and this sort of touches on knowing your healthcare related rights, is that you have a right to appeal any denial, reduction, or termination of services. If you don't agree with it, and most folks don't if they believe they need something and it's been denied. The denial notice is supposed to say in writing why something was denied. Sometimes denial notices don't include as much detail as we might want, but they are required to give, insurance entities are required to give notification in writing about what is being denied and why. And then from there, you have a window of time in which you can appeal that decision. And that varies based on what type of coverage you have. Right now, under the public health emergency created by COVID-19, everyone has 120 days to appeal mass health decisions. Usually that window is much shorter. Before the pandemic, it was only 30 days, so like a quarter the amount of time. Although some MCOs did give 60 days. Mass Health has let us know that once the public health emergency ends, we are not going back to 30 days. We will have more time to appeal, but it's not going to be 120 days, unfortunately. But right now, everyone who has mass health coverage does have 120 days to file that appeal. And for many types of decision, there will be an internal appeal for managed care entities before things go before the Board of Hearings. But someone who has fee-for-service supports would go straight to the Board of Hearings. There wouldn't be an immediate sort of first level appeal before that. And then for private plans, there's even more time. There's 180 days to appeal. But there's always going to be an internal followed by an external review. And just like for Mass Health, the external review will be before the Board of Hearings. Okay, so that's a sort of broad overview of what it looks like to appeal a decision that you don't agree with. The good news is, as I touched on earlier, Mass Health has a lot of things it's supposed to be approving under its current guidance. So we started out with coverage of surgery guidance in September 2016 that expanded its supports to include hair removal as part of covered surgery preparation. There are the current guidelines, as I mentioned earlier, do require prior authorizations. They require an assessment of a licensed, qualified behavioral health professional who has diagnosed the member with gender dysphoria. And there are unfortunately, a lot of time-based requirements. So things might end up needing a lot of attention in order to get all of the ducks lined up in a row in order to access gender-affirming care in the form of surgery. And my organization does a lot of trying to help folks through that process and appealing decisions where something has been denied. We do unfortunately see denials for a number of reasons on coverage of surgery. And it is something we are happy to support folks with. Coverage of electrolysis was recently expanded as well, both in the gender affirming surgery context and in its own right as a form of gender affirming care. So electrolysis, as of last year, electrolysis of the face and neck is covered as a treatment of gender dysphoria under Mass Health. It's subject to a medical necessity determination for other conditions on a case-by-case basis. And this goes back to what I was saying about how gender dysphoria looks different in different people. And so it requires documentation to show that it might be medically necessary, but it is not categorically excluded. Okay, so that's a sort of broad overview of a lot of different things. But the big takeaways that I want to make sure folks are aware of are that you do have rights to certain types of care under Massachusetts coverage laws. My organization is happy to help if you run into any issues accessing gender affirming care. And this is a field that is expanding, and we are trying to refine and make function better over time. But it is a process, and it's a process that everyone on this call is happy to help. Updating for name changes is going to be covered under the Knowing Your Legal Rights section, so we'll talk about that in the next panel. Okay, that's all for me.
This is Leslie Diaz. Thank you so much, Hannah, for going over how to get enrolled in Mass Health, as well as going through the other types of coverages that are available for folks who are looking for health insurance, and Kara for going through what is a very complicated and often challenging system to go through when it comes to really picking out the important things from all the policies and regulations. And I will just say that personally, my ombudsman, we work closely with Healthcare for All and Health Law Advocates, and they've both been excellent resources, both for when people are unsure as to how to navigate signing up for health insurance here in Massachusetts, or if it's something that's much more legal, much more related to the legal path of getting services. Health Law Advocates has been incredibly helpful as well. So thanks to you both. I will start off with a quick introduction of my ombudsman, and I know we'll be taking a break in a few minutes, so I'll keep an eye out then for time. For now, I'll just get started on sharing my screen so that I can go through a quick introduction of my ombudsman, and then we can go into a little bit more about how we could help folks who are already signed up for Mass Health, but don't really know what the next steps are for getting gender affirming care services covered, or any other healthcare services, because we help with all types of Mass Health benefits. So I'm going to share my screen. And I'm going to keep an eye out on the clock so I can make sure I'm staying good with time. All right, so as I mentioned, my ombudsman is a resource that is available to everyone in Massachusetts, anyone and everyone who needs help getting their Mass Health benefits put in place. To talk to you a little bit more about my ombudsman and our mission, we are an independent program that's operated by the DPC, the Disability Policy Consortium, through a contract with Mass Health. At my ombudsman, we empower individuals, including their families and caregivers, to exercise their rights and access the services provided by Mass Health. So our mission is to ensure that Mass Health members understand their healthcare rights and their health plan benefits so they can get the care they need, whether this is specific to gender affirming care, whether it's to do with getting other types of services put in place for in-home services, or things like medical equipment. Anything that Mass Health typically covers, will be able to help navigate how to go about getting that. And one really big thing that's part of the my ombudsman's identity is being rooted in disability rights. Since we are housed and operated by the Disability Policy Consortium, one really major aspect of our work is that we're focused on disability rights and the ability to access healthcare no matter what situation or circumstance you're in. We were we were chosen to be run by an independent nonprofit so that the ombudsman program could remain neutral and could provide a really strong community resources to folks who are seeking support with getting their Mass Health services covered. And because of that, because we're rooted in disability rights and disability history, the majority of our staff at DPC and my ombudsman have lived experience with disability. And because of that, we can relate to often the challenges that come up when you're trying to get certain services, certain prescriptions, medications, supports, et cetera, covered through health insurance. And some of us have also been Mass Health members. So we know the challenge, and we know that self-advocacy, plays a huge role in getting what you need. And we just want to be that support for folks who reach out to us for help. And we are focused on member rights, which you'll hear a little bit more about in a bit. But again, just really coming back to what are folks' right when it comes to their rights when it comes to healthcare insurance, Mass Health specifically, and how that connects to disability rights overall. So I'm going to talk just very generally about what we do, and then we'll take a little break. And then we'll come back and finish up with the example that I want to provide, and then go into any questions that might come up from for any of us on this panel. So my ombudsman gives information about Mass Health covered benefits, services, and member rights. So any questions that you have about whether this is covered or that is covered, whether this type of surgery is covered or this type of hormone therapy is covered, or maybe even this particular prescription, or whether a new wheelchair will be covered, we can let you know what Mass Health offers. And we can also let you know what the process is for getting those services put in place. And we will be that essentially that guide through the whole process if you'd like us to be. We help people understand how to exercise their rights, as Kara mentioned. When people get denied a service or a medication, it's not always common knowledge that you have the right to ask Mass Health to reconsider that decision. So we help people know about their rights to appeal, as well as other rights to file complaints, to file grievances if necessary. And because of that, we're always, again, providing one-on-one support and encouraging self-advocacy wherever possible. We just want to provide folks with the tools to be able to know what to do next if any situations like this came up again in the future. So one more slide before we take our break. I know we get this question a lot. Who exactly can we help? We can help anyone who has Mass Health. So as long as you have Mass Health, whether it's your primary insurance or your secondary insurance, whether you have Medicare as your primary and Mass Health as your secondary, or if you have one of these plans that are listed on the slide, which are many, there are over 35 plans, then you can qualify for our services. If you're not sure what Mass Health you have, or if you're not sure if you're still in Mass Health, we can check that out for you. We can also work with Healthcare for All if you do need to be reinstated into Mass Health. So there are plenty of options, no wrong door. If you're not even sure whether we can help you because you're not sure if you have Mass Health, just give us a call anyway, and we'll do our best to find the right place to help you. So again, we help anyone who has Mass Health or enrolled in any of these Mass Health plans, including OneCare, SCO, SEO, PACE, PACE, or any of the ACO, MCO health plans, the primary care clinician plan, and folks who are using services through the Massachusetts Behavioral Health Partnership, also known as MBHP. All right, so now that we have a good sense of who we help, the next thing we'll go into is a little bit more about our team. So you know who we are, and then we'll go into a quick example followed by some time for questions. So I talked a little bit about my ombudsman and what we do, and I wanted to show you also the process of how we work so that you're familiar with what it's like when you're reaching out to us and asking for help getting your Mass Health benefits covered. So the first person that you reach out to when you call us is a real live person, community liaison, who will either connect you to community resources. So sometimes you might just have a pretty simple question and say, who can I reach out to for therapy services or for some support in talking through the different types of services that are available regarding gender affirming care for me personally. And so we might connect you to an organization that helps folks connect to community supports. We have some great partners who were also here on day one of the event that we're hosting today. So please do take a look at the recording for some other examples of great organizations that we might refer to. So I want to make sure that you know that even if we're not the right ones to help, we can always refer you to the people who can. No wrong door here. But if it is a situation that you need help with, then that my ombudsman can help with, then your case will be assigned to an ombudsman who will then be really the person that you'll be in contact with most of the time to be able to communicate with your health plan, with Mass Health, and any other providers that you have involved, working together to try to figure out how to get you the thing that you're looking for, the service that you're requesting. And the whole time, we're really keeping you at the center of the process so that you know exactly what's going on, and all the choices that we're making are making sure that you're the ones making the choices. So that's just something to remember, which is true for, I think, any working with any providers, making sure that you're the one who is making the decisions for your care. So I'll go into another example similar to Hannah and Leslie and Kara, I'm sorry, about what sort of issues might come up as you're trying to access gender affirming care. So this is not a real story, but one that we've gotten snippets about here and there that do happen pretty frequently. And so I'll just talk about a member who reached out to us. Let's say that their name was Carla, and Carla is having trouble getting a gender affirming surgery authorized and approved by Mass Health. And actually, this is Carla's perhaps the first time really exploring this option, and heard about it maybe from some community supports that and peers that she's been in contact with. But unfortunately, it's not really clear what the steps are needed to take those to access those services. So in a situation like that, we might be reached out to Carla might reach out to us and ask, what sort of services does Mass Health cover? And so let's say that Carla is specifically looking for top surgery, and so we would have kind of these questions in the back of our mind as to what kind of Mass Health coverage does Carla have, and if Carla doesn't know, then we can certainly look that up. And then we would look into, again, not necessarily asking Carla these questions, but more so having these in the back of our mind. What rights does Carla have? What are the steps that needed in order to access top surgery? For example, is there a prior authorization required? Yes. Is there, are there other requirements? Like, does Carla need to have had a primary care provider involved, including a behavioral health provider, like a therapist, involved for some time? And the answer to that is yes. So there's different things that we will try to make sure Carla has awareness of what's needed before getting these services approved. And we also want to make sure we're giving or taking into account that whether there are any barriers limiting Carla's ability to getting these services. So maybe the PCP that they had in mind are too far away. And so maybe we need to actually request some support in getting Mass Health to cover another type of provider. Maybe they're out of network. And so we try to help with that. Perhaps language is a barrier, and we need to make sure we're looking for providers who speak Carla's primary language, or at least set up interpreters for Carla to be able to navigate these services in their primary language, and make sure that there's no misunderstandings or miscommunications that could happen because of that. So we're really trying to think about the whole big picture when it comes to the question, how do I get X service? And so, let's say that there is, we do go through the whole process of getting this top surgery request considered, and for some reason, Carla lets us know later that this service has been denied by Mass Health. We would investigate that. We would take a look at the denial letter, try to figure out what exactly it is that was missing or that needs to be proven in order to have the service covered. And that's where we might either mediate with Mass Health and try to resolve the issue. Sometimes it's an administrative issue. Sometimes it is more involved, and we need to reach out to the providers to get more documentation to show medical necessity. But other times it does become more complicated, in which case legal representation might be a better option than mediation. So that's where we'd most likely reach out to our friends at Health Law Advocates for support and connecting this member to them. But overall, we want Carla to walk away with the tools to self-advocate, because a lot of these processes are really complicated. And, moving forward, if there are any additional supports that are needed, Carla hopefully has at least a sense of where to find information about it, how to connect to the resources that can help navigate through these complex policies and regulations. And then also really showing Carla that there's support out there for them, regardless of whether it's related to health insurance or healthcare. We really love to connect people with community resources that provide them with support outside of navigating healthcare. And so some folks ask how we may be different in terms of Mass Health customer service or other types of agencies that might help with benefits questions. And so we really emphasize that we provide a lot of hands-on support as much as one needs to get their questions answered or any challenges addressed. And because we don't focus on eligibility or enrollment, we would have to refer out for those questions. But one advantage to being separate from Mass Health is that we are able to stay neutral. We don't have access to any health records until we have your permission. So we are able to access those records if you give us permission to, but we really try to stay neutral and make sure that we're giving you and Mass Health all the information needed to make the best decision possible. And overall, in the long run, we hope that the more that people reach out to us about concerns, whether it's about gender affirming care and having trouble accessing it, or maybe the types of questions that come up, maybe there's one question that comes up a lot and we need to report that to Mass Health. We hope that overall that will provide some level of impact on strengthening policies or procedures that Mass Health can provide to improve members' access to healthcare. So in summary, our goal as my ombudsman is to help folks exercise their rights and their benefits as a Mass Health member. And because of our professional and cultural experiences, we're able to approach folks with respect and understanding. And we always abide by a listen first philosophy, acknowledging that folks are the members, that members are experts on what you need. And we work to empower folks with education and support to help you understand any challenges, any questions that you might be having with your healthcare benefits. And so with that said, I know we will be releasing this information out to registrants after the event is over, but here is our contact information. We are the only healthcare ombudsman program in the country that has a deaf ombudsman. Our Director of Deaf Services, Lori Seidman, can work with folks in American Sign Language or anyone who identifies as deaf or hard of hearing or does not and might just have needing help with hearing and any auditory services. We speak Spanish, Creole, as well as Farsi and French. So we have some languages to add to these slides, but overall, if you need help with anything, we are able to find interpreters in almost any other language, over 165 languages we have at our disposal. So just wanted to make sure you all knew that, so that if you ever have questions, you feel comfortable reaching out to us. And again, if it's not us who can help, we will find the right place. I will go ahead and pause here and try to make sure we get the questions that we got answered from our Q&A, which I know we answered via the chat already, but just to make sure that we have these answered. I know we get the first question about how to go about updating our name with Mass Health / my coverage / any insurance if I legally change it. So do either Hannah or Kara want to answer that? I know we have an answer in the chat, but it'd be great to have it on the recording as well.
I can start. Hi, this is Hannah. So what I actually shared in the chat is there's a Mass Health webpage that kind of gives a little bit more information about changing your name with Mass Health. I know that they want to put out further guidance on this and are thinking through their policy. but right now they require that you have changed your name with Social Security before you can update it with them. There's some ways of getting around that. Basically, part of the application, it says, does your name match with your Social Security number, the name that's on your Social Security number? And so you can kind of get around that in some ways by saying no, and just having that, the name that is on your Social Security number listed there. But there can be some difficulties if you don't have like documents for certain doctor's visits. So I think generally, if you change your Social Security, you're able to change it more easily with Mass Health, but otherwise you might need assistance. And I don't know with private insurance, I don't know that they would have the same policy that it has to be changed with Social Security. Kara, I don't know if you know anything more about that.
Individual insurance policies will probably differ based on the insurance entity. I don't think there's any kind of blanket requirement under the DOI.
Thank you. Thanks both. And then the other question was answered again, once again in the chat and also a little bit through our presentations. But in one question is, my Mass Health plan told me that the clinician I want to see as my primary care provider is too far away from where I live. Are there any ways to get exceptions to this? So I know, Kara, you had talked a little bit about it as well during your presentation. I will say that my ombudsman can help with this as well. So, you can reach out to virtually any of us to see if a provider that you're interested in is able to either participate in the network temporarily or just for you, or maybe they're planning to join the network. Or if the PCP is too far away and they're already in the network, there are some exceptions, again, depending on whether this person is culturally competent, for example, and able to provide services in a way that other providers near you can't. So there are certainly ways to get exceptions that my ombudsman can help with. But anything that you wanted to add, Hannah or Kara?
This is Hannah. So I think actually all of our organizations could help with this, which is great. And with Mass Health specifically, there is this service area exception that Leslie was kind of referencing. And I think we could help escalate with that. It's a little bit different when you're finding, a provider that's out of state, or when there isn't like an appropriate provider in the network, which is probably where like CARE and HLA has a lot more experience with too.
Yeah, just to validate what Hannah was saying a minute ago, my organization does help in situations where folks, generally the way we see that come up is if someone needs a form of specialty support that just doesn't exist in a meaningful way within the state. But we do sometimes work with folks who are seeking supports for folks who are out of network or out of state. And we would be happy to support folks who run into issues related to that.
Wonderful, thank you. I am looking for any more questions, and so far it doesn't look like we have any new ones. So thanks for those questions. We know we get them. All right, so I think then what we'll do next is go ahead into our second panel, and we get the pleasure of hearing from Kara again, this time doing a deeper dive into healthcare rights. So we'd love to hear from you again, Kara.
All right, I'll go ahead and share my screen again. Okay, so hopefully folks are able to see another set of slides that says Know Your Healthcare Rights. I'm still Kara Hurwitz, a staff attorney with Health Law Advocates, and I'm still the project lead for the Transgender Health Access Initiative at my organization. But I'm going to talk about an interrelated topic, which is, as it says on the tin, knowing your healthcare rights. People have a number of different rights related to accessing gender affirming care and accessing healthcare in general. So I'm going to start by talking about what protections exist here in Massachusetts. I'm also going to do a very shallow dive into some of the trends that we're starting to see pop up in other places, just so that folks are aware of them. And then I'm going to talk a little bit about what federal protections exist for everyone across the country, even in places that are maybe starting to restrict their state-based rights. And if you have any questions on this as we go, please feel free to put them in the chat. I'm happy to pause and answer them. But we'll also be leaving some time to address questions at the end of this panel. Okay. So without any further ado, let's talk a little bit more about right to access care in Massachusetts. Access has improved in a lot of places over time regarding state-based access. 24 states, including Massachusetts and Washington, D.C., now prohibit private insurance exclusions for gender-affirming medical care. And that's gender-affirming medical care in general. It is still, unfortunately, legal for folks to have categorical exclusions for specific types of gender-affirming care if they feel there is not sufficient documentation to support that it is medically necessary as a form of treating gender dysphoria. But private insurance entities are not allowed to just say, we don't cover gender-affirming medical care. That is illegal in about half the states in the country, including this. And I included the note about where we were in June 2016, just so that folks are aware of how much things have been changing in a relatively short time frame. So that number was almost half as low in June 2016. And now, only 6 years later, it's half the country that provides that support. Similarly, 23 states, including this one, prohibit, as well as Washington, D.C. and Puerto Rico, now prohibit Medicaid exclusions. Again, broadly, Medicaid exclusions for gender-affirming care in general in a medical context. So Mass Health, among other states, is not permitted to say we just don't cover gender-affirming medical care. As we talked about in the previous panel, Mass Health goes pretty far in the other direction. There are a lot of different types of gender-affirming medical care that are categorically covered if they're shown to be medically necessary. And again, just to go back to what this looked like in June 2016, only 11 states and Washington, D.C. had that protection in June 2016. So this is a field that's evolving a lot and evolving in health insurance terms pretty rapidly. 6 years is not a long time for a lot of types of insurance changes, and yet we've seen a lot of changes relating to gender-affirming care. And in the case of these places, it is getting broader. Unfortunately, in other places, it's getting narrower. And we've seen states increasingly passing legislation that limit that access. I've included some examples from the past year on this slide regarding restrictions in Arkansas, restrictions in Alabama, restrictions in Arizona, and restrictions in Texas, mostly regarding access of gender-affirming care by minors. That sort of seems to be a gateway tactic in a lot of places. We are unfortunately also starting to see some movement. There was an effort in Florida relatively recently to try to restrict Medicaid coverage of gender-affirming care, which is, of course, the opposite of the slide we just saw, but it's a move in the other direction, unfortunately. So I think it's important for folks to be aware that this is a topic that is unfortunately not viewed universally in this country, and it's relatively divisive, especially when we're discussing access of gender-affirming care for minors in the U.S. But that being said, I also want to make sure folks are aware that Massachusetts is an area with a great deal of protections in place. So I pulled this slide down from the Movement Advancement Project. I included the link to this, what was originally a screenshot in the alt text of this slide. But this is sort of a tally they do for every state that shows kind of where the state is in terms of their civil right protections and supports regarding sexual orientation. And as you can see, we're 16.5 out of 20.5 for that. Gender identity policy, and we're 17.5 out of 22 for that. And overall tally, they've marked us as a state that has high protections. We are certainly not perfect, no state is, but we have a lot of protections in place here in Massachusetts. We have banned conversion therapy, which is something I mentioned in the previous panel. Gender identity is a protected subclass for issues of discrimination, and sexual orientation is a protected subclass for issues of discrimination. That said, we've had a road to get here as well. And again, just going back to what I was speaking about a few minutes ago, we've seen a lot of progress in the last 5 to 10 years. Here in Massachusetts, the decision to require coverage of treatment for gender dysphoria by the Division of Insurance, which regulates private insurance entities, what happened in June 2014. They actually just reaffirmed that with more information in this past fall, in September of 2021. And I've included a link to that guidance so that folks can see it, but it essentially broadens the general guidance that you can't discriminate against people on the basis of needing gender affirming care. And it talks a little bit more about what might be considered sort of categorical discrimination regarding that issue. In 2015, Mass Health did something similar. They issued their first guidelines for gender affirming care. They updated those also in the fall of 2021, so pretty recently, for both gender affirming surgery and for hair removal. And we talked about this a little bit in the previous panel regarding the ways that Mass Health expanded kind of guidance and coverage in order to make more things potentially covered pursuant to a medical necessity determination, and fewer things became categorically excluded over time. I see a note that we have 5 minutes until break, so I'm going to spend a couple of more minutes on Massachusetts related protections and give a minute or two for questions, and then I'll wait until after the break to launch into the federal protections, which of course impact everyone, even people in the states that I mentioned a few slides ago that have started increasing restrictions of access to gender affirming care. So just to continue with the trend of changes in Massachusetts related supports, we actually just saw a really major step forward this past summer in July. It was a bill that was, I believe, H5090 was the name of the bill. And it provides direct protection for accessing gender affirming care. And this is not regulatory guidance. So if I go back to the examples from the Division of Insurance or Mass Health's guidance, that's what's called like regulatory or sub-regulatory guidance. Those are things that the entities have chosen to issue as sort of rules for how this works in Massachusetts. I want to contrast that with the July provision, which is now woven directly into our legislation. So it's now required by law from our lawmakers that everyone has to do this as a form of disability protection. And the relevant provision, this particular set of laws relates back to gender affirming care and reproductive health. So it's partially a response to the Dobbs decision that was issued by the Supreme Court recently. But the exact language is that access to reproductive health care services and gender affirming health care services, they're both rights secured by the Constitution and laws of the Commonwealth. So that's a very firm protection woven into our laws in a very solid way, specifically regarding the right of gender diverse people to access gender affirming healthcare services. It is not something that is viewed as optional. It is a right that people have here in Massachusetts. So I'm glancing at the time. It looks like we have like 1 or 2 minutes more. I'm happy to pause for any questions that folks have. Oh, excuse me, I have one more slide regarding Massachusetts. So I will cover that, and then we will go on break. But I also wanted to mention a couple of additional supports that were put in place in the last year or so. I touched on this a slide ago, but the DOI bulletin I mentioned a few minutes ago, it specifies that denying medically necessary treatment on the basis of someone's gender identity or gender dysphoria. So denying someone because of their gender identity, not because they've concluded it's not medically necessary, but sort of explicitly saying, this is not granted to you because you are a trans individual, for example, is prohibited sex discrimination under Massachusetts law. So this is echoing something that we're going to talk about when we get to the federal section, that I think is really important, which is the idea that when any body of laws talks about sex discrimination, discrimination on the basis of sex, this language here in the DOI bulletin and also President 1557 really explicitly is saying that if you discriminate against someone because they are transgender, you discriminate against someone because they've experienced gender dysphoria, that is discriminating against someone on the basis of their sex, and that's illegal in Massachusetts and federally. So that's a very strong protection that I want to make sure folks are aware exists very solidly here in Massachusetts, and also is in the process of being adopted very solidly on the federal level. So that bulletin that I just mentioned, it applies to fully insured private health insurance plans. There's also a Massachusetts law under public accommodations that covers insurers, including private insurers as well as public insurers. So those are additional protections that exist specifically around discrimination against people in healthcare settings.
All right. So first of all, thank you for having me today. My name is Mason. I use he, they pronouns. In my full-time work, I am Deputy Director for the Division of Education and Training at the Fenway Institute. And in that, I do a lot of training, particularly in healthcare settings on LGBTQIA+ affirming care. I am an attorney by training. I am an advocate as well. For those who are, I know the majority of the audience is in the state of Massachusetts here. For folks who were here back in 2018, I was co-chair of the Yes on 3 campaign, which was the first and only statewide vote on transgender rights in the country. I'm very glad it's the only, and I'm always happy to chat more about that. But for today, I'm just talking a little bit about some considerations in terms of documents, gender affirming and overall affirming documentation, particularly identity documents like state IDs, passports, etc. Really coming at this from the perspective not only of transgender and gender diverse folks, but also intersex communities as well. A few things I want to start off with. First of all, the concept of legal gender. I get this question a lot of like, well, somebody should just list their legal gender on their documentation. I'm here to bust the notion that legal gender actually exists in any one uniform way. I'll use myself as an example here. The gender marker that is on my state ID is different than the gender marker that is on my passport, and that is different than the gender marker that is on my birth certificate. What is my legal gender? I have no idea, because it really doesn't exist in any kind of uniform way. And you can have situations like my own where we have multiple gender markers on multiple forms of ID. And for that reason, that kind of uniformity that we would seek in any kind of legal documentation doesn't exist for this. Moving on to name changes, and I'll speak more specifically to name changes in Massachusetts and a little bit broader as well. But it's important to note that name changes are not, legal name changes are not accessible for many, many people around the country and in our state. They are inconsistent, they are inexpensive, and in some situations and in some probate courts and with some judges can be actually not safe for a name change. Turning this a little bit into a focus on healthcare and insurance, there can be insurance barriers for gender affirming care, both in accessing gender affirming documentation and by not having gender affirming documentation. I'll talk a little bit more about that as well. There are, of course, so many unique considerations for those who are born outside the US, for military and folks who are currently in the military or veterans, for documentation, for all sorts of professional licensure, if that is applicable. and so much more that can really change exactly how somebody interacts with systems to change a legal name or a gender marker. All right. Thinking about name and gender marker changes within Massachusetts specifically, the steps for changing a legal name involve first going to a probate court, then going to Social Security, then going, obviously in this state, to the RMV. In other states, it might be the DMV, but we're focusing on Massachusetts right now. We go to the RMV for changing a name on a state ID or driver's license, then passport, and then I would say there's a lot of space between passport and birth certificate that a lot of folks may change other forms of documentation, whether it be professional licensure, student IDs, things on like a FAFSA form, even deeds or property documents. All of those types of things usually happen after one gets the passport. And I generally recommend the birth certificate goes last. That, of course, is going to change for maybe folks who are younger folks who need a passport or a birth certificate changed in order to play sports in an affirming gender or things like that. So, of course, there can be changes to this process. It is not a step 1, step 2, step 3 for all people. So that can change based on access, age, state, immigration status, etc. Beyond some of the basics of these steps, there are so many legal documents that can be around that needed change for name and gender markers, like health insurance or life insurance or homeowners insurance, renters insurance, all of those documents, banks, wills, medical directives, mortgages and deeds, student loans, etc. It's really difficult for so many folks who are transgender, diverse, or intersex going through changing gender markers and all of this legal documentation to actually sit and think, what systems have my name? In which case, these systems need to be updated and changed with my affirming name. It can be a lot to unpack, and it can take many years. I have had my name changed for well over 10 years, and there are some documents that I still haven't changed because it's just maybe a hassle. Maybe it's not a system that I interact with often, but that means I occasionally get mail home with the wrong name on it. So that leads to the question, if one legal document is updated, but others aren't, what does that mean? Well, it depends on the systems that you're working with or operating in. So for instance, if a name on your state ID or passport is one thing, but maybe your health insurance is another, that can lead a lot of electronic health records to kind of glitch out of like, what's happening? I don't know how to handle this situation. And it can lead to a lot of folks who work in healthcare to not be quite sure what name should be listed on documentation. In general, especially for health purposes, if you are billing an insurance, you should use the name that is consistent with that insurance company so that you don't get an error or somebody getting bounced back in the cost and they suddenly now don't have insurance coverage because there's a wrong name. So that's one consideration. Many folks in the state of Massachusetts and some of the other, I think 13 other states that have X gender marker available on state identification. Great. I have an X gender marker on my own ID, but it raises some questions, particularly as you're traveling, say going through TSA. I have experienced TSA agents kind of looking at my ID, seeing that X gender marker and certainly raising some eyebrows, but it has not, for me, gotten in the way of travel. Of course, I have to recognize all the privilege that goes along with my being able to travel and the fact that I am white, that I am perceived as masculine, and that carries with it a lot of privilege in systems that would maybe lead somebody to not question that gender marker. Another area we see some questions, comments, concerns is around selective service, particularly for young folks. There's some great materials on the website, on the National Center for Trans Equality on how to navigate selective service. It'll depend on the age of the individual and other circumstances. So just a note there. Known challenges within Massachusetts that are worth noting. Oh, my apologies. I'm getting a note to slow down. Sorry, I have a small amount of time, but a little bit more to cover, but I'll slow down. My apologies. So known challenges here in the state of Massachusetts. One is with birth certificate updates. Currently, state law in Massachusetts has a very unique situation, to my mind, which is in order to change a gender marker on a state-issued birth certificate in the state of Massachusetts, one has to be required to change their name on that birth certificate. So you can see how maybe somebody who is non-binary or intersex, or maybe has a gender affirming name that was on their birth certificate to begin with, they may not want to change their name, but they may want to change a gender marker on a birth certificate. They would be prohibited from doing so. In order to change a gender marker on a Massachusetts birth certificate, you have to change your name as well. Other challenges include publishing requirements. So in Massachusetts, in order to change your name through probate court, there is a requirement to publish that name change. You can see how that would be a major concern for trans and gender diverse and intersex individuals, because it is basically outing somebody as trans in the local paper or online forevermore. We have been successful in proving a waiver for those publishing requirements in the vast majority of probate courts. However, not all. We have seen some probate courts saying that somebody's gender identity is not enough to submit a waiver for those publishing requirements, and therefore requiring trans or gender diverse people to publish their name change in a local paper. That goes to my third point here on known challenges: inconsistency in probate courts. Some probate courts have asked trans folks to come in for a name change hearing. Others have not. Some require publishing, some do not. So there can be all sorts of challenges and inconsistencies just in the first step of a name change in Massachusetts. All right, last slide I have for you in the last 2 minutes here is something I love to talk about, because it's one of those moments where, as a lawyer, I get to say the law helps. The law actually helps trans, gender diverse, and intersex folks here, which is a common law name change in the state of Massachusetts. We are a state that allows for common law name changes, which basically, as this quote from Richard V. Mason, not me, Mason, different case, but this case, Richard V. Mason says, by merely adopting another name, provided that it is done for honest purposes, is enough for a legal name change. So you don't technically, by this case law, do not have to go to probate court for a name change, so long as you are adopting another name for honest purposes and utilizing it consistently. That is considered your legal name. Now, of course, that can lead to some challenges of documentation in order to change your name, say, on a passport or social security, which requires a formal probate court name change documentation. However, this has been particularly helpful for youth and students in changing a legal name through school systems. Sometimes schools will push back and say, we have to have the name on our records that is your legal name. Well, by common law, that is their legal name because it is adopted for honest purposes. So if you're working with young folks who are struggling with a name change, then that could be one thing that could be helpful for folks. All right, so with that, I have about 15 seconds left. I just want to say thank you. Thank you for having me. Thank you for being here. And I can turn it over to questions. I covered a lot. And again, my apologies for speaking a little bit quickly, but I'm happy to answer any questions that can be helpful in this topic, as well as others that I might know a little bit more about.
This is Leslie. Thank you so much, Mason, for that really great information. And it's great to see in both situations, in both presentations, I mean, from what Kara presented and Mason, you just did, that the law is changing in ways for the good. So it is encouraging to see that. So it doesn't look like we have any questions, which is totally fine, because we will be sharing this information out to the public, to all those who registered for day 1 and day 2. We'll be sending out the recordings. If there are any technical glitches, we might have not been able to record every single part, then please do make sure you're looking at the materials that we send in addition to the recording, as well as the transcript, which might help if you're looking for some specific words or language that we used. So thank you again to all of our panelists today, Kara from Health Law Advocates, Hannah from Healthcare for All, and Mason from Fenway Institute for helping us really get to have this information about legalese essentially in a more accessible format to the public. So thank you for helping us with this. And day one events, that wanted to thank you all again for attending the panels on where to go for your healthcare needs and what a healthy doctor visit looks like. We'd love to take any more questions if anything comes around in the future. You'll have the name of our organizations and also a resource guide that we'll be publishing and releasing to all who registered so that you can find local offices that might be able to help with your questions. It'll be divided by categories. You'll see what I mean when you get it, but hopefully we hope that you took a lot away from this event in our efforts to make gender affirming care easier to understand, to navigate, and easier to access overall. So thank you so much for all of our attendees and all of our presenters today and on day one. We'll be wrapping it up now. Have a great weekend, everyone.